Welcome to the Abundant Wellness Podcast. I'm Andrea, registered nurse, functional health practitioner, author, and mom navigating the very real trenches of parenting kids with sensitive, complex nervous systems. This podcast is for parents who are tired of being told to just try harder, who feel the grief of realizing you can't fix your child, but still refuse to believe that this is the end of your story. Here, we talk about what actually helps: nervous system-informed parenting, functional health, the gut-brain connection, emotional resilience, and faith in the middle of the mess. See, you're raising a child who's not broken, but deeply wired. My hope is that every episode helps you to feel less alone, more anchored, and better equipped to support both yourself and your child. If you're ready for compassionate science, honest conversations, and hope that doesn't bypass reality, you're in the right place. Let's get started. Hello, and welcome to another episode of the Abundant Wellness Podcast. Today, we have an amazing guest, Dr. Kathy Cantwell. For over 30 years, Kathy has dedicated herself to pediatric chiropractic care, driven by a passion to help children in a world that often feels overwhelming. As a mother in a blended family of 5 children, Kathy learned the complexities of child development and family dynamics on a personal level, which has deepened her empathy and understanding in her clinical practice. In recent years, she's seen a tremendous rise in neurodiversity and other sensitivities among children, many of whom are navigating traumas, constant digital stimulation, and the weight of modern stress. Kathy utilizes numerous tools, not just traditional chiropractic care, in her practice to bring neurological balance and reduce suffering to children and their families. So thank you for joining us today, Kathy. Hello, everybody. So we have Dr. Kathy here today on the podcast, and you heard my little introduction of her. So Kathy, welcome. I'd love for you to share just a little bit about yourself and your practice, and then we'll dive into all the fun questions and conversation that we have prepared for today.
Sure. I've been a chiropractor this is my 35th year. I graduated in 1991. I got my pediatric diplomate, my postdoctorate diplomate degree 30 years ago in 1996. So that's pretty exciting. And I've been a chiropractic patient myself since I was basically in middle school, or maybe just a little bit before that. Actually, I guess it was a little bit before that. And so this is sort of a way of life for me. I always like to say that chiropractic is not my profession. It is actually who I am through and through. And so I love what I do every day. I'm bummed that it's my 35th year. I wish it was my 5th year, but yeah. I'm planning on being around for maybe, who knows, maybe even 2 more decades, because I just, I'm so fortunate that I get to say I love what I do every day.
Oh, I love that. And I think that's honestly what keeps us in the game, right? Because the work we do is hard work. Sometimes it takes a lot of dedication and effort. And especially, we'll talk about this with especially the rise of chronic illness, the rise of chronic issues that we're seeing, the rise of neurological issues that we're seeing in children specifically. There's so much, I think, for me, it gives me some added pressure to continue learning and growing because the need is so great, right? But the love is what keeps us in the game. So I love that it's a way of life for you. I feel the same about my practice. And we're going to talk a little bit more about Unity Chiropractic and what sets you guys apart in terms of pediatric chiropractic care as well. Would you like to share a little bit about what makes you guys different?
Sure. I mean, we're a nervous system-based chiropractic. And I think that that's really important to look at. In actuality, all chiropractic is really nervous system based. And so because the whole philosophy is that we're really only using muscles and bones as levers to get pressure off of the nervous system. But in our clinic and our world, we're just a little bit more intentional about it. And so when we're treating kids, we're just looking at a little bit more. So we're looking at nervous system development. And we're looking for any little hitches along the way. And sometimes those hitches are even while the mother was pregnant with the child, because we know that makes a big difference. We cannot ignore the fact of the father either.
Right.
And so because, he's bringing half of that DNA, into that baby. And, and what did the mother go through pregnancy? So Like when we're taking a history, it's not about like what's happening today. We care about what's happening today, but we also care about what's been happening. And so we're going to be asking a lot of questions about all of their milestones. I'm sure lots of people here are know that the CDC took crawling out of milestones, which is awful. I mean,
I can't even, I saw that and I was just, I literally lost for words. Like if you're not watching the video of the replay, I'm like, I don't even have words for how
right.
ignorant and illogical
And wrong, right.
it's just on every level. It's so bad. Yeah.
Right. Because all of those milestones are what helps our brains develop.
Right.
And so, we have this whole trajectory of brain development. And so we need all of those milestones to happen when they're supposed to be happening. And, classically, I was taught the 3, 6, 9, 12. And so, your rollover, sit up, crawl, walk. And they've pushed all of those back a little bit. So rolling over is now like 3 to 6, and sitting up is 6 to 9, and things like that. And, I think it's important to differentiate between common and normal.
Yes.
And so what they've taken as common, now they've made that normal. And, and that's not really right. Like we need those things to happen along the way. And so that's one of the things that we look for in our practice. So when we say nervous system based, we want to know, how did that nervous system actually develop? Like what happened? There's a lot of things right now that are keeping babies from integrating a lot of their primitive reflexes. And some of that may be the fact that there's a thing now that we call tummy time. But when I was young, there was no such thing as tummy time. Babies were all put on their bellies to sleep. That didn't change until the mid-90s. And so, but now there's tummy time. And, and now the parents are encouraged to do what, like 10 minutes a few times a day. And that so many of your reflexes integrate when you're on your belly. And so it's hard. And then babies are put in containers. They're not getting their movement. They're not, doing all their stuff. So it's really hard. So I guess, at the end of the day, we're saying that we're more of a nervous system focused chiropractic clinic that's a little bit different. We do see adults too. So we do that as well. But our primary focus is going to be pediatrics from infant on. Right. And we're just trying to get pressure off of that nervous system to put in that like foundational regulation. So
absolutely. Well, I love that you shared that, because that was my second question, which was, when parents hear chiropractic care, many of them think posture or pain. They're not thinking about that nervous system development, reflexes, whether or not they've been integrated, stress that can be emotional, physical, inflammatory, infectious, right? All of those things that impact the nervous system. And, so we're looking at our kids and we're not, because the education has not been there. I know you're doing the education, but it's not in the parenting books, right? That
it's not.
If I don't allow my child to be on their tummy for a certain amount of time, this could connect to difficulties in learning, right? Difficulties in sleeping. And I know this, I only learned this because I had both of my kids had to go through reflex integration therapy. And some of that was, obviously our genetics needing some help, but also just different stressors. My oldest daughter has pandas. And so that was, that inflammatory cascade affected every part of her neurological function. And so learning that and actually watching them go through the movements, I started to connect the dots with their earlier development of like, oh, I saw my oldest do this, but I didn't see my youngest do this. So my oldest had all of that stuff neurologically and then lost it due to pandas. My youngest was a little bit slower. Like you said, this is why that timeline, that early timeline of crawling, walking, rolling over, all of that matters. Talking, right? Babbling, all of those things are signs and indicators of where and how their nervous system is developing. And so what are some common signs? Because I think this can feel very overwhelming for parents. And I know you do a really good job. I've watched your Instagram videos and I love them. I love them. They're so fun and so educational too. But what are some common signs that suggest a child's nervous system is under stress? And I'm using the word under stress because I think that's probably the easiest thing for parents to understand and attach themselves to,
Right.
right?
Sure.
Or not regulating well. Maybe that's a better
Right.
way of saying it.
But some of your smaller signs are going to be things that we don't really think are a big deal. And that can be something like, like they can't stand the tags on their shirts, or, the seams in their socks are not lined up properly, in their shoes. They have to wear a certain shirt. I mean, whatever it is. So that would be like some of your smaller signs. But then we can get into a lot of the bigger signs, and that's going to be more of your behavioral signs. Maybe
Yes.
they're not sleeping properly. Maybe they're not making friends properly. Maybe they're not even socializing with their own family members properly. So they're having a lot of meltdowns. Maybe the meltdowns are normal at a younger age, but it's not going to be normal for a 7-year-old, to be having
Right.
like huge, huge meltdowns. And so it sort of means that they're stuck, and they're stuck in that sympathetic state.
Right.
And then how do you get them out of that sympathetic state? And, so that's really hard. Living in fight or flight is no fun for anybody.
No.
Not fun for the child, not fun for the family. Like, it's not fun,
No.
at all. But you can start looking at little tiny things. Maybe they're coloring and they're freaking out because they went out the lines, or maybe they're just sitting there and just breaking crayons. And you think, oh, that's pretty normal. They're a kid, but not if they're sitting there and like just like breaking, right? So some of those might be some of your earlier signs,
Yeah.
and there is something to be said where there are some early signs too of autism, so if you have a baby who's, flapping, or,
Right.
something like that, you kind of want to be on the lookout.
Absolutely. That's really good. And I think where a lot of families are getting caught is like later, right? Once their child has received a diagnosis of ADHD, anxiety, autism, PDA, ODD, or they're like in that waiting for a diagnosis process. And it's like, okay, but if we look back, and I remember this because we had to go through with the reflex integration intake where you're checking on all of these boxes, right? When did they do this? Did they experience this then? And as she was checking all of the reflexes, she would ask me questions like, did they have any sensory aversions to food or food allergies that I had not even connected that to that this could be related to nervous system dysregulation,
Sure.
right?
Yeah.
And so a lot of parents, I feel like they're caught downstream when if assessments had been made earlier, and this is not shame on the parents and it's not shame on the practitioners, but it's just like the more we get the knowledge out there, the quicker parents can get in. And, ideally we could prevent how many percent of these diagnoses later on.
Right.
Right. And so when you have a kid that comes in with anxiety, ADHD, autism, meltdown, sensory processing issues, I know we have to be careful not to use the term like heal, right? Or fix or change. But how often do we see those symptoms completely go away or resolve when we're actually integrating reflexes, healing the nervous system, regulating the nervous system? How often do you see in your practice that kind of decrease?
There's going to be some kids that are never going to have a complete resolution. So if you have a nonverbal autistic child, who's, perhaps even wearing diapers or having accidents, and they're already 6, 7, 8 years old, whatever, you're not going to take that child and you're not going to mainstream them into, what's quote unquote considered normal in our society. But you can help to make them better able to handle stressors, to live in the world and everything like that. But then you talk about things like anxiety, and I don't want to say like, oh, that's so much less, but that is something that is a whole lot easier to treat.
Right.
And so those are the type of things, your anxiety, your ADD, your ADHD, those are the type of things that you are actually shooting for a complete resolution. And I think we'll get into this a little bit more later. But another thing that we do look at is simply open mouth breathing too. So we look for sleep
100%.
disordered breathing.
Yes.
And that's a huge rabbit hole. So a lot of these kids living in their sympathetic state have their mouths open.
Right.
And, so we're going to be working on that as well. We have to get that nervous system regulated first.
Parenting a child with ADHD, autism, PDA, anxiety, or ODD, and you are exhausted trying to figure out what's actually going on, I want you to hear this. Many of the kids I work with also struggle with symptoms like constipation, diarrhea, bloating, skin issues, or brain fog. And while it can feel like the behavioral and digestive pieces are separate, they're not. They are deeply connected. And that's why the Happy Tummies, Happy Kids program helps to resolve this problem. It is a 4-month root cause approach program that looks at your child's whole system through a functional lens, not to change who they are, but to improve their function and reduce suffering regardless of the diagnosis. If you're wondering whether this kind of support is right for your child, the next step is to book a Strong Start discovery call. It's a conversation with me to understand your child's unique needs and see if this program is a good fit for them. You can schedule a Strong Start discovery call using the link in the show notes. You don't have to figure this out alone, and I look forward to hearing from you soon. Absolutely. And I love that you addressed that, because I probably need to have a whole other episode just on airway, airway issues. Because that also, unless I feel like you happen to land at an airway, a dentist that specializes in airway, they're not asking those questions of, does your child sleep with their mouth open? They're not helping us to connect the dots between the child who's struggling with dyslexia or ADHD in their schooling and their nighttime breathing, right?
Sure.
Or the fact that they have a super narrow palate, right? And so they're not able to get that tongue to the roof of their mouth. And a lot of what I see, and this kind of ties into my next question, obviously, having had a child go through reflex integration and integrated chiropractic care, I can never look at, I've been ruined for looking at occupational therapy, physical therapy, feeding therapy, functional medicine, even the same. Because again, in my pediatric background, working in the hospital, we would have kids with specific injuries, or developmental disorders that we would have to have OT and PT come in and teach them how to learn how to feed again, right? Or walk again, or breathe on their own without a breathing tube. I mean, there's all these kind of things. And they're really what I would consider top-down therapies, where they're trying to access the cortical tissue in the brain, right? Which is that higher level learning, when really it needs to be bottom up, right? From the bottom of the root system, which is the nervous system in the body. Yeah. And I can say this with a fair amount of confidence because I had a child go through that. I also work in neurofeedback, so I work a lot with brains. When we work from the bottom up, and you can correct me if I'm wrong on this, everything else seems to come so much faster. Anything that you're doing to try to get the airway to work properly, or their mouth to work properly to form words, or to sleep well, all of that kind of integrates fairly naturally without a whole lot of resistance. Would you say that that's been your experience as well?
Absolutely. And you're doing top down. I sometimes go outside in, and we're going inside out. Same thing, same premise. And for us, I mean, you think of the chiropractic adjustment again, and especially when you are adjusting the upper cervicals and doing your cranial sacral therapy, that you're also relieving pressure on that vagus nerve, or stimulating that vagus nerve to work better, because your vagus nerve comes out right here, right where the temporal and occipital come out together. And that also ties in, again, not to go down a rabbit hole, with the sleep disordered breathing. And so nerves 9, 10, and 11 exit that jugular foramen together. So those three nerves sort of work together. You stimulate one, you stimulate them all. And which is why, for vagus nerve stimulation, you can gargle. Humming is actually one of our favorite things to do, because
it's easy and free.
Right. Yeah. Because you're stimulating that glossopharyngeal nerve, which is going to help to stimulate the vagus nerve. But nothing's going to help if it's being pinched. It's sort of if you have your finger in a car door, you can do all the therapies in the world, but ultimately, for healing to happen, you have to open the car door, and that's our job. And so we get in there and we do our chiropractic adjustment, which is always age appropriate chiropractic adjusting. and then doing some of our craniosacral therapy with it. Craniosacral therapy is meant to go after an adjustment. And
Okay.
so that, like you said, is your bottom up.
Yes.
And so we're actually going to adjust the body first. So that's your bottom before we do the cranials. And that I think is really important. And craniosacral therapy is kind of interesting because it's gotten like a rap where like anybody can take a weekend course and do it. And I'm thinking, are you kidding me? I went through.
I wouldn't feel comfortable. No, I mean, I'm super comfortable touching people. That sounds really bad, but like I've been a nurse for a long time. Like being in human contact with people is not an issue for me. But if you have ever felt even just a tiny baby's skull, because you can feel all the bones and how quickly and easily things move, obviously that's different anatomically than an adult, but it's like, no, I would not feel comfortable after taking I'd want some mentoring and some hands-on.
Sure.
It takes a lot of skill, I think, is what you're trying to say. And I think that that's appropriate to be skeptical if that's not in place.
Right. Just to get my regular craniosacral license, I actually went through all the coursework twice before I decided to sit for the boards, because after the first time I was feeling a little bit overwhelmed.
Yeah.
And there's just so much stuff.
Right.
And so I went through it a full another year before I sat for boards. And then when I took my pediatric cranials, I also went through that coursework twice. So my sense of confidence is good, but I'm still always learning. And
as we should be. Right. And I think our patients are our best informers and they're our best educators because they're letting us know where we're missing the gaps, right?
Sure.
That's how I feel in my practice. It's like, oh, they're letting me know where I have gaps in knowledge and how can I lean into some resources, either and learn it myself or resource them to somebody else to fill in those gaps. At no point is that I feel like Western medicine does a really good job of making it the patient's fault when that happens. Like, and I think for us, in the line of work that we do, like for me personally, that just is more fuel in the fire for me to do better and learn more and be more excellent. I know that not all of us are wired that way, but I would say that I would imagine that that's how you feel also. It's yeah.
My relaxation is watching classes and taking notes.
Yeah.
And
always, right? So would you say then, if you have a client that comes in, a patient that comes in and their child is in occupational therapy or physical therapy or PT or neurofeedback, or maybe they're working with a functional medicine provider, I think you've kind of already answered this, but doing chiropractic work in the way that you do that's nervous system focused can only benefit those therapies. Would you agree that I can't think of a single instance in any case that I've ever worked, functional medicine, neurofeedback, whatever, where that has not benefited the client in their healing?
Absolutely, because it takes a village. And, and sadly, sometimes like OT's not working or PT's not working, or why is that reflex still active after a year? And, like what is going on? And so you have to get back into your foundation, and your foundation is your nervous system. Right. And so you have to get in there and, get the pressure off of that nervous system, and so that those nerves can flow properly. And then in the craniosacral, the only reason you do craniosacral, a lot of people think that it's like, to shape a baby's head or, to relieve sinuses. But in actuality, it's to pump craniosacral fluid through that dural sheath. And and that's super, super important. And so sometimes, working in collaboration is really, really helpful, but, kids can get stuck, so even if we're not working with the child in their PT, their OT, and obviously we're not speech language pathologists, we're not orthodontists, but we work in collaboration with them, and it helps. So everything is just to help the child, and so that they can function better, and so that their bodies can sort of like accept the therapies.
Absolutely. I think that's it right there. You just landed right on it, which is that their body can accept the therapies. And, we've been, just to share a little bit of my own personal, like from a parent perspective on this. We were in reflex integration therapy, which is like a combination of OT, PT, body work. I don't really even know how to encapsulate all that it does. The intensives are like 20 hours a week.
Sure.
For about 3 weeks, you take a break, you see what's integrated, you do it again. And I can say that because of where my daughter's brain inflammation was at from pandas, where her physical body was at in terms of inflammation, certain things didn't stick, right? Because her nervous system was so inflamed. Now, that doesn't mean that all of that work wasn't beneficial. It just means that only a certain amount of it could be accepted, like you said, because the nervous system was in a certain amount of fight or flight because of the infections. A lot of people don't know that your nervous system can be inflamed.
Sure.
Right? So we had to pause some of those therapies, let her body heal some more, come back and do some therapies later, and other things began to integrate. Other things also healed without us doing more therapies. So it's kind of like, I think the big takeaway for parents in this is, if you're not sure what that is, one, make sure you're working with somebody who can help you to identify that, whether that's a functional medicine provider or like Kathy, a chiropractor that specializes in this. But if you feel like your child is stuck, then make sure to kind of zoom out and look at how am I supporting the nervous system right now? Because if the body doesn't feel safe, even if we have a safe home environment, right, and a safe family environment, that's not what I'm talking about. Like the nervous system doesn't feel safe. It's going to be hard to learn.
Right. And your daughter was a more extreme example with the pandas. Yeah. But again, when we talk about common versus normal,
yes,
people right now think that things like eczema or chronic constipation are normal because so many people have it, and you just treat it with your cream or your Metamucil or whatever it is, and that's not right. That's a system that's inflamed.
Right.
And so, and again, can a chiropractic adjustment heal eczema? Well, probably not. But
not on its own, maybe. Yeah.
Right. But somebody like yourself who's going to look at the microbiome and figure out what's going on is going to be very foundational for that child as well. Lots of parents think that they're feeding their child well because their child's getting chicken, but it might be in the form of nuggets. And,
with seed oils and different things that are just super inflammatory. Yeah.
Right. And we've even caught some of the parents in our clinic, telling their child, okay, let's do this. And then I'm going to take you for ice cream. And you're like, no.
Please tell me it's dairy free. Yeah.
Right. Well, they're not just going to take them for ice cream. They're going to put sprinkles on it.
I know.
And, you're like, oh my gosh, the food dyes, the poisons. And, so, those are other things to look at in the household as well as, are they actually even getting like real nutrition?
Right.
Or are they eating, seed oils and food dyes and all of that kind of stuff.
And, and the truth is we all have to start somewhere. Right. And I think especially if you're dealing with a child that maybe has some anxiety or some oppositional behaviors or a lot of meltdowns, that's really hard because it's like, I know that they should be eating better, but if the only thing they will eat is the chicken nuggets, then you know what I mean? And so this is where it's like, this is, again, going back to the point of getting the nervous system in alignment. You should start to see the flexibility in the nervous system to say, you know what, I'm going to buy the gluten-free ones and the ones that are organic, gluten-free, don't have any seed oil chicken nuggets. And I'm going to just see if they notice. Like they probably won't even notice this time. So which then is like, if you're in that place as a parent, please make sure you're also treating your own nervous system because
absolutely,
raising kids with these struggles is very hard on the body.
And sometimes when you're making those changes, like you said, like we'll keep using chicken nuggets.
Yeah.
So let's say that you're making the change from whatever popular brand that you buy frozen into your gluten-free or organic. I always tell the parent, put them in the old box.
Yeah.
Because let me tell you, that kid knows, they know what that box looks like.
Right.
And so if you put it in that box, you can be just like, I don't know, this is the same as we always buy. And so, And of course there's an age where that's not really going to work as well.
Right.
But there are little things that you can do that you can start with.
Yeah, absolutely. And I probably will do a separate episode where we talk about food and how to be smart and sneaky about getting them good food, and how to bring your child in, especially if they're more like PDA oppositional. They feel a need for a lot of autonomy and control. There's a lot of tricks that I learned during that season of, one, I am the gatekeeper of the home. And so there are certain things that I don't care if you rage about it, you're not getting it,
Right.
But there are other things where if I'm really wanting to increase like green vegetables, right, then I'm going to bring you to the store with me. I'm going to include you in the choices. I'm going to include you in how that food is being prepared. I'm going to make you the food investigator, which takes a lot of the pressure off. And I'm just asking you for input on flavors and textures and smells. And there's a lot of ways that we can do that. But the nervous system work actually helps make that not a problem. So
Right.
Yeah.
And like you said, you mentioned smells. And so you're bringing in, again, like the cranial nerves.
Yeah.
And smell is oftentimes an overlooked area.
Absolutely.
And it's a really important part of our nervous system and our nervous system development. Like, in my mind, I can still tell you what my grandmother's house smelled like.
Right.
And, I can't really describe it, but I would know that smell, and that's, and that's going to bring forth, feelings of, love and everything like that.
Right.
And, so it's really interesting how the nervous system works and incorporating those different cranial nerves into it, which is, also what we try to do in our therapies.
I love that. And I love how comprehensive you are in your clinic, and just, that you're taking great care to train up really qualified practitioners. I think we all know that it's going to take more than just one of us, right? And so duplicating ourselves and duplicating our processes and making sure that, that standard of excellence is really there is really important. One of the biggest and most easily fixed issues that I see in parents raising neurodivergent children or parents of children with a complex medical diagnosis is actually mineral deficiencies and low electrolytes. When we are under chronic stress, as raising these children is chronically stressful, we run through our electrolytes and our minerals very, very quickly, which then puts a lot of stress on pretty much every organ system in the body. So one of the things that I teach a lot of the parents that I work with is a very quick action step, which is to just grab a scoop of electrolytes and add it to your water 1 to 2 times a day. It's one of the easiest ways that you can nourish your body so that you don't end up in a state of depletion. When we are mineral balanced, when our electrolytes are balanced, we sleep better, we respond to stress better, we bounce back a lot quicker from events that are really stressful. So one of the electrolytes that I use is Paleo Valley. They're super duper clean, no food coloring, no yucky ingredients, super affordable. I have a 15% off link for you in the show notes. One thing that you can do to care for yourself today is to grab some electrolytes, add it to your water, and remind yourself that you're worth nourishing too. The one other thing I did want to ask you, because I think this is part of what sets you apart in this kind of practice, is what types of modalities. You already mentioned craniosacral, kind of more the standard or traditional classic chiropractic care. What other modalities do you use in the clinic? And what does that typically look like for you?
Sure. So one thing that we try to keep in mind is in your nervous system, we kind of think of like a triangle.
Yeah.
And so you have your somatosensory system, and that's going to be like, oh, look, I just bent my right elbow. So that information goes back to the brain. We have our vestibular system. And so that's going to be our movement. That's our relationship to gravity, and of course our balance, and then our visual system. And we're not really talking about visual acuity so much as, the normal range of motion of the eyes. Can you converge? Can you diverge? Your saccades, can you look at a blackboard and then look at a paper and keep on track on what you're doing? So those things are in the back of our minds as we move through what modalities that we use. And so, yes, you're definitely going to get your hands-on adjusting and your cranial work, but we're also going to be checking your vestibular system. And we usually do that via a balance pad.
Okay.
And so we have the children stand on a balance pad, feet together, close their eyes, and you look at which way their body sways. And so from that, the first thing we'd like to do is so you adjust and you're checking out your vestibular system.
Mm-hmm.
So right there, you're thinking about that little triangle again. And then you're going to take them through their therapies. So if they're in our neurocognitive program, let's say that they're working on the moral reflex. So we're going to think about the normal trajectory of brain development. So you're going to go like primitive reflexes into movement, touch, into audio, verbal, into ocular motor, before you get, to the very top, and that's that visual cognition. And, there we're good. So we're going to take that moral reflex. We're going to take it through all of those steps. So we might start very simply doing some basic integration with the moral reflex. Then we're going to use it with movement touch. Then we're going to use a little audio sounds with it. And so we're going to take it through that whole trajectory of brain development. And while we're doing that, our like secret weapon is that we use low-level laser light therapy.
I was just going to ask you, if you guys use lasers or lights, in your therapy.
We do. We use the Erconia Class 2 low-level laser light therapy. And I've been using their therapies for, over 20 years. And the results that I have gotten from it have been absolutely remarkable. I always like to talk just a little bit about like why theirs is so important. One is that it's a Class 2. And so lasers are actually rated on whether or not they can hurt eyes. So a Class 2 is safe, and a Class 3, 3B, 4, not safe. So those emit too much power. And there's a difference between energy and power. Your lasers that have the most energy actually have low power. And that's what makes them safe to use, and safe to use even for a length of time. They are non-thermal. It is a coherent light. So an LED is a scattered light, and these are very focused, coherent lights. They are going to emit light at certain numbers of wavelengths. So the wavelengths that we use is 405, which is your violet. And I'd like to think of the violet. So it does a lot more than this, but just loosely, your violet is going to be antimicrobial.
Oh.
And then you think of your 635. 635 is your red. That one is great for the brain. It's great for scar tissue. It does help musculoskeletal things. So the red does an awful lot too. And that one probably has the most popularity. And then a couple of years ago, they introduced the green. And the green is 520. And so I like to loosely think of the green as sort of the linchpin for mitochondrial health. And so we have all these different levels, these electron train transport systems, and the different colors sort of like fill in the little notches in there. And once that's complete, that is what allows ATP to be made to feed the mitochondria. So when you're using these lasers, I just tell patients, it's sort of like if you have a car, it's like putting more engines in the car and then more gas for all of the engines. Wow. And so ours are safe over brains. They are safe over open growth plates, or God forbid that somebody had something nasty growing inside of them. It doesn't proliferate cancer cells. And other lasers actually can't say that. Ours is photochemical, and other ones that they say lasers, most of them are not. They're photothermal, and they're really just a heat lamp. And so ours are very, very safe. I can usually help thrush in a couple of visits. Like that one is super easy. So we've got patients coming in all the time. And sometimes patients are just coming in for laser treatments. And sometimes these are like older patients. Like one of our regular patients just had a surgery done, and he had a deviated septum repair. And of course you come out just, completely bruised. And so we had him running right in and doing the laser. And after a few days, all the bruising's gone and his swelling's almost gone. And he's only a couple weeks out of surgery.
That's amazing.
And so it's really fun. And they're great for, colds and flus and different things like that.
That is amazing.
Yeah.
You have a lot of tools in your belt there.
Right. We do. And like I said, we love that now. In our typical visits too, I mean, the things that we're doing with kids, I mean, we kind of call them games. And of course, you've seen some of them on our Instagram.
Right.
And, so we might have a child, walking backwards, looking up to a metronome. and we're going to try to set that metronome to like 54 beats per minute. At 54 beats per minute, we know that that's going to bring the frontal cortex, the basal ganglion, and the cerebellum all working together as a team.
Wow.
Those things become really important. But at the beginning, a child can't handle that.
Right.
And that is way too much input. And so that would be something that they would do like as they progress along. So hopefully that explains.
It does. No. And I think the takeaway that I want parents to take away from this is that you want to be working with somebody that can use multiple tools and know how to apply them when they're needed, right? Because maybe not all of those tools are needed for every child in every visit, but it sure is nice to have them when you do, because cells have to be communicating in order for the nervous system to be working properly. Inflammation has to be regulated. That's a bidirectional relationship. And so and of course, I'll put all this information in the show notes, but as we wrap up today, how can people get a hold of you? Number one. And number two, if they're not local to the Oregon, Washington area, how can they find somebody that does work like you do? Would that be like looking at the board certification website or?
Oh, gosh.
I know it's the loaded question, but I know people are going to ask. So,
okay. For us, it's pretty easy. UnityChiroBeaverton.com is our website. So that's pretty easy. You can also find us on Instagram. And so getting a hold of us that way is pretty darn easy. As far as looking nationwide, it becomes a little bit tougher. What we have done in our clinic, and of course, there's 3 of us doctors there. And so myself, Dr. Jesse Garrison, and Dr. Kyle Grunwald. So with the 3 of us, we have undertaken so many different classes and so many different types of certifications. And we've taken them all and we've put them together. And we're still going forward. You and I had chatted that we both like Dr. Krause, and he does functional neurology and functional medicine. So he's one of our favorites. Urconia actually teaches a lot of the neuro stuff too. And so they'll do some of the functional medicine and the functional neurology, and then some of it is how you incorporate lasers with it, but some of it is just how do you do it. So that's a really tough question. But as far as finding somebody who at least has a good, solid pediatric foundation, please find somebody who has a real degree, a board certified degree. And so that's going to be through the ICA, the International Chiropractic Association, through their pediatrics, which is, I think it's ICA.org, or I should know their website off the top of my head. That is actually where I got my diplomate through. And then there's also the ICPA, and that one is ICPA for kids. And so look for somebody there. Interestingly enough, I'm on their website, but it doesn't list my degrees on there because I got them from a different organization. But I really do have them, which is fine. But please find somebody who has the real education. As of right now, those are really the two that I would recommend for finding somebody who has, the right letters after their name and who knows what they're doing. And sometimes even if they're just in the classes, but they're listed, even that is great because it means that they're always learning.
Right.
So, and then call their office, stock their stuff. We do occasionally have patients who've moved or something like that who reach out to us, and we have tried to help to find people in their area who do work similar to ours. Wow. And so there definitely is people who do similar work to ours, and we are so happy to connect them. I mean, there's the Molino method with him is going to be, really great. There's Josh out of Iowa, and
Madsen.
for some reason, yes. Oh, so, losing his last name.
That's okay.
And, and so, I mean, and we're doing a lot of what they're doing too.
Awesome.
And, but it is hard actually to find somebody who actually puts all of that stuff together.
Absolutely. I would agree. And I have experienced it too, because I've been looking for somebody up here and I'm like, okay, this is not listing, pediatric chiropractic. That's good that they have some experience working on little bodies, right? But maybe that's not as specific as I'm looking for. So thank you for sharing how to kind of vet that as parents. And, I'm kind of the thought process that any chiropractic with a good practitioner is better than none. if you absolutely cannot find somebody like what Kathy and her team does at Unity Chiropractic, any with a good chiropractor is better than none. But there are kind of these layers and advanced areas that sometimes our kids really need when they're really struggling. And so I will make sure to add all of your information to our show notes today. And I just wanted to say thank you again, Kathy, for your time and sharing your expertise with the community and also the online community.
Oh, my pleasure. This was a ton of fun. And maybe next time we'll talk about the sleep disordered breathing.
Let's do it.
That one is huge. So,
right.
But thank you so much for having me on your show. This was fun.
It was a pleasure.